About the triple negative. Black women are twice as likely, is that true, to have triple negative than white people are?
Certainly much more likely. Yes, absolutely.
All right. We don't know why, like you said, but tell us about triple negative and why that's such a big deal.
So, every breast cancer is different. There's so many subtypes of breast cancer. Triple negative breast cancer is one of the more aggressive subtypes, if perhaps not the most aggressive subtype of breast cancer that we see in clinic. And it means that the cancer is ER negative, estrogen receptor negative, PR negative, progesterone receptor negative, and HER2 negative. So in very simple terms, it is not estrogen fed and not HER2 driven. So those targeted therapies we use as anti-estrogens and anti-HER2 treatments do not apply. And so what we have in our toolbox for those women is really chemotherapy. Triple negative breast cancer, the early stages have a higher chance of returning as metastatic disease, particularly within the first 2 years after they're diagnosed. So that's kind of the danger period for those women. Certainly a much higher risk of returning than other cancers that are estrogen fed. And when they do return, they're more difficult to treat as metastatic disease versus the other subtypes, and more likely would lead to a woman's death within the first 2 to 3 years of diagnosis of metastatic disease.
So comes to diagnosis, she has a diagnosis of triple negative, you treat her, and then after 2 years, there's a greater likelihood it's going to return. And once she returns with metastatic disease, in another 2 years, she's dead.
Yes, that's about the average survival, unfortunately, with metastatic triple negative breast cancer. With treatment, it's about 2.5 years. It has improved over the last 5 years from about 12 to 18 months. We've doubled the survival, but clearly there's still so much work that needs to be done for these women. So again, in order to prevent metastatic disease, finding breast cancer very early would most likely lead to a full cure and avoid metastatic disease down the line. That's why it's so important for our women to have these screening mammograms to detect breast cancer early to avoid eventual, ultimately fatal metastatic disease.